Hello, future pharmacists. Welcome back to my channel, Rrb the Pharmacist, where we break down everything you need to know to ace your exams and become a successful pharmacist. In today's video, we're diving into one of the most crucial aspects of your exam preparation, pharmacology multiple choice questions. These MCQs are not just any questions, they are the top most asked questions that frequently appear in government exams such as Railway Pharmacist, ESSEC, SSC Pharmacist, SBI Pharmacist, and Junior Pharmacist exams. Whether you're gearing up for the Railway Pharmacist exam, preparing for the ESSEC test, or aiming to crack the SSC Pharmacist, SBI Pharmacist, or Junior Pharmacist exams, these MCQs will be your best friends. We'll cover the key topics, provide detailed explanations, and give you tips on how to tackle these questions effectively. So, grab your notebooks, get comfortable, and let's get started on mastering pharmacology MCQs. Don't forget to like, subscribe, and hit that bell icon so you never miss an update. Let's jump right in. Alright, here's our first question.
1. Pharmacokinetics is A. The study of biological and therapeutic effects of drugs. B. The study of absorption, distribution, metabolism, and excretion of drugs. C. The study of mechanisms of drug action. D. The study of methods of new drug development. Answer is B. 002. What does pharmacokinetics include? A. Complications of drug therapy. B. Drug biotransformation in the organism. C. Influence of drugs on metabolism processes. D. Influence of drugs on genes. Answer is B. 003. What does pharmacokinetics include? A. Localization of drug action. B. Mechanisms of drug action. C. Excretion of substances. D. Interaction of substances. Answer is C. 004. The main mechanism of most drugs, absorption in GI tract is A. Active transport, carrier-mediated diffusion. B. Filtration, aqueous diffusion. C. Endocytosis and exocytosis. D. Passive diffusion, lipid diffusion. Answer is D05. What kind of substances can't permeate membranes by passive diffusion? A. Lipid-soluble. B. Non-ionized substances. C. Hydrophobic substances. D. Hydrophilic substances. Answer is D006. A hydrophilic medicinal agent has the following property. A. Low ability to penetrate through the cell membrane lipids. B. Penetrate through membranes by means of endocytosis. C. Easy permeation through the blood-brain barrier. D. High reabsorption in renal tubules. Answer is a 007. What is implied by active transport? A. Transport of drugs through a membrane by means of diffusion. B. Transport without energy consumption. C. Engulf of drug by a cell membrane with a new vesicle formation. D. Transport against concentration gradient. Answer is D008. What does the term bioavailability mean? A. Plasma protein binding degree of substance. B. Permeability through the brain-blood barrier. C. Fraction of an uncharged drug reaching the systemic circulation following any route administration. D. Amount of a substance in urine relative to the initial dose. Answer is C009. The reasons determining bioavailability are A. Rheological parameters of blood. B. Amount of a substance obtained orally and quantity of intakes. C. Extent of absorption and hepatic first-pass effect. D. Glomerular filtration rate. Answer is C010. Pick out the appropriate alimentary route of administration when passage of drugs through liver is minimized. A. Oral. B. Transdermal. C. Rectal. D. Intraduodenal. Answer is C011. Which route of drug administration is most likely to lead to the first-pass effect? A. Sublingual. B. Oral. C. Intravenous. D. Intramuscular. Answer is B012. What is characteristic of the oral route? A. Fast onset of effect. B. Absorption depends on GI tract secretion and motor function. C. A drug reaches the blood passing the liver. D. The sterilization of medicinal forms is obligatory. Answer is B013. Tick the feature of the sublingual route. A. Pretty fast absorption. B. A drug is exposed to gastric secretion. C. A drug is exposed more prominent liver metabolism. D. A drug can be administered in a variety of doses. Answer is A. 0114. Pick out the parenteral route of medicinal agent administration. A. Rectal. B. Oral. C. Sublingual. D. Inhalation. Answer is D. 01 Parenteral administration. A. Cannot be used with unconsciousness patients. B. Generally results in a less accurate dosage than oral administration. C. Usually produces a more rapid response than oral administration. D. Is too slow for emergency use. Answer is C. 016. What is characteristic of the intramuscular route of drug administration? A. Only water solutions can be injected. B. Oily solutions can be injected. C. Opportunity of hypertonic solution injections. D. The action develops slower than at oral administration. Answer is B. 017. Intravenous injections are more suitable for oily solutions. A. True. B. False. Answer is B. 018. Correct statements listing characteristics of a particular route of drug administration include all of the following, except A. Intravenous administration provides a rapid response. B. Intramuscular administration requires a sterile technique. C. Inhalation provides slow access to the general circulation. D. Subcutaneous administration may cause local irritation. Answer is C019. Most of drugs are distributed homogeneously. A. True. B. False. Answer is B. 020. Biological barriers include all except A. Renal tubules. B. Cell membranes. C. Capillary walls. D. Placenta. Answer is A. 021. What is the reason of complicated penetration of some drugs through brain-blood barrier? A. High lipid solubility of a drug. B. Meningitis. C. Absence of pores in the brain. Capillary endothelium. D. High endocytosis degree in a brain capillary. Answer is C.
022. The volume of distribution, VD, relates a single to a daily dose of an administrated drug. B. An administrated dose to a body weight. C. An uncharged drug reaching the systemic circulation. D. The amount of a drug in the body to the concentration of a drug in plasma. Answer is D. 023. For the calculation of the volume of distribution, VD, one must take into account a. Concentration of a substance in plasma. B. Concentration of substance in urine. C. Therapeutical width of drug action. D. A daily dose of drug. Answer is A. 24. A small amount of the volume of distribution is common for lipophilic substances easy penetrating through barriers and widely distributing in plasma, interstitial and cell fluids. A. True. B. False. Answer is B. 25. The term biotransformation includes the following: A. Accumulation of substances in a fat tissue. B. Binding of substances with plasma proteins. C. Accumulation of substances in a tissue. D. Process of physicochemical and biochemical alteration of a drug in the body. Answer is D. 26. Biotransformation of the drugs is to render them A. Less ionized. B. More pharmacologically active. C. More lipid-soluble. D. Less lipid-soluble. Answer is D. 27. Tick the drug type for which microsomal oxidation is the most prominent. A. Lipid-soluble. B. Water-soluble. C. Low molecular weight. D. High molecular weight. Answer is A. 28. Pick out the right statement. A. Microsomal oxidation always results in an activation of a compound. B. Microsomal oxidation results in a decrease of compound toxicity. C. Microsomal oxidation results in an increase of ionization and water solubility of a drug. D. Microsomal oxidation results in an increase of lipid solubility of a drug, thus its excretion from the organism is facilitated. Answer is C. 029. Stimulation of liver microsomal enzymes can A. Require the dose increase of some drugs. B. Require the dose decrease of some drugs. C. Prolong the duration of the action of a drug. D. Intensify the unwanted reaction of a drug. Answer is A. 30. Metabolic transformation, phase 1, is A. Acetylation and methylation of substances. B. Transformation of substances due to oxidation, reduction or hydrolysis. C. Glucuronide formation. D. Binding to plasma proteins. Answer is B. 31. Biotransformation of a medicinal substance results in A. Faster urinary excretion. B. Slower urinary excretion. C. Easier distribution in organism. D. Higher binding to membranes. Answer is A. 32. Conjugation is A. process of drug reduction by special enzymes. B. Process of drug oxidation by special oxidases. C. Coupling of a drug with an endogenous substrate. D. Solubilization in lipids. Answer is C. 33. Which of the following processes proceeds in the second phase of biotransformation? A. Acetylation. B. Reduction. C. Oxidation. D. Hydrolysis. Answer is A. 34. Conjugation of a drug includes the following except A. Glucuronidation. B. Sulfate formation. C. Hydrolysis. D. Methylation. Answer is C. 35. Metabolic transformation and conjugation usually results in an increase of a substance's biological activity. A. True. B. False. Answer is B. 36. In case of liver disorders accompanied by a decline in microsomal enzyme activity, the duration of action of some drugs is A. Decreased. B. Enlarged. C. Remained unchanged. D. Changed insignificantly. Answer is B. 37. Half-life. T is the time required to A. Change the amount of a drug in plasma by half during elimination. B. Metabolize a half of an introduced drug into the active metabolite. C. Absorb a half of an introduced drug. D. Bind a half of an introduced drug to plasma proteins. Answer is A. 38. Half-life. T doesn't depend on A. Biotransformation. B. Time of drug absorption. C. Concentration of a drug in plasma. D. Rate of drug elimination. Answer is B. 39. Elimination is expressed as follows. A. Rate of renal tubular reabsorption. B. Clearance speed of some volume of blood from substance. C. Time required to decrease the amount of drug in plasma by 1/2. D. Clearance of an organism from a xenobiotic. Answer is D. 40. Characteristic unwanted reaction which isn't related to a dose or to a pharmacodynamic property of a drug is called A. Idiosyncrasy. B. Hypersensitivity. C. Tolerance. D. Teratogenic action. Answer is B. 41. Idiosyncratic reaction of a drug is A. A type of hypersensitivity reaction. B. A type of drug antagonism. C. Unpredictable, inherent, qualitatively abnormal reaction to a drug. D. Quantitatively exaggerated response. Answer is C. 42. Therapeutic index. T. Is A. A ratio used to evaluate the safety and usefulness of a drug for indication. B. A ratio used to evaluate the effectiveness of a drug. C. A ratio used to evaluate the bioavailability of a drug. D. A ratio used to evaluate the elimination of a drug. Answer is A.
001. Local anesthetics produce A. Analgesia, amnesia, loss of consciousness. B. Blocking pain sensation without loss of consciousness. C. Alleviation of anxiety and pain with an altered level of consciousness. D. A stupor or somnolent state. Answer is B. 002. A good local anesthetic agent shouldn't cause A. Local irritation and tissue damage. B. Systemic toxicity. C. Fast onset and long duration of action. D. Vasodilatation. Answer is C. 003. Most local anesthetic agents consist of A. Lipophilic group, frequently an aromatic ring. B. Intermediate chain, commonly including an ester or amide. C. Amino group. D. All of the above. Answer is D. 004. Which one of the following groups is responsible for the duration of the local anesthetic action? A. Intermediate chain. B. Lipophilic group. C. Ionizable group. D. All of the above. Answer is A. 005. Indicate the local anesthetic agent, which has a shorter duration of action. A. Lidocaine. B. Procaine. C. Bupivacaine. D. Ropivacaine. Answer is B. 006. Which one of the following groups is responsible for the potency and the toxicity of local anesthetics? A. Ionizable group. B. Intermediate chain. C. Lipophilic group. D. All of the above. Answer is C. 007. Indicate the drug, which has greater potency of the local anesthetic action. A. Lidocaine. B. Bupivacaine. C. Procaine. D. Mepivacaine. Answer is B. 008. Ionizable group is responsible for A. The potency and the toxicity. B. The duration of action. C. The ability to diffuse to the site of action. D. All of the above. Answer is C. 009. Which one of the following local anesthetics is an ester of benzoic acid? A. Lidocaine. B. Procaine. C. Ropivacaine. D. Cocaine. Answer is D. 010. Indicate the local anesthetic, which is an ester of para-aminobenzoic acid. A. Mepivacaine. B. Cocaine. C. Procaine. D. Lidocaine. Answer is C. 011. Which of the following local anesthetics is an acetanilide derivative? A. Tetracaine. B. Lidocaine. C. Cocaine. D. Procaine. Answer is B. 012. Indicate the local anesthetic, which is a toluidine derivative. A. Lidocaine. B. Bupivacaine. C. Prilocaine. D. Procaine. Answer is C. 013. Which of the following local anesthetics is a thiophene derivative? A. Procaine. B. Ultracaine. C. Lidocaine. D. Mepivacaine. Answer is B. 014. Local anesthetics are A. Weak bases. B. Weak acids. C. Salts. D. None of the above. Answer is A. 015. For therapeutic application, local anesthetics are usually made available as salts for the reasons of A. Less toxicity and higher potency. B. Higher stability and greater lipid solubility. C. Less local tissue damage and more potency. D. More stability and greater water solubility. Answer is D016. Which of the following statements is not correct for local anesthetics? A. In a tissue, they exist either as an uncharged base or as a cation. B. A charged cationic form penetrates biologic membranes more readily than an uncharged form. C. Local anesthetics are much less effective in inflamed tissues. D. Low pH in inflamed tissues decreases the dissociation of non-ionized molecules. Answer is B. 017. Which one of the following statements about the metabolism of local anesthetics is incorrect? A. Metabolism of local anesthetics occurs at the site of administration. B. Metabolism occurs in the plasma or liver, but not at the site of administration. C. Ester group of anesthetics like procaine are metabolized systemically by pseudocholinesterase. D. Amides such as lidocaine are metabolized in the liver by microsomal mixed function oxidases. Answer is A018. Indicate the anesthetic agent of choice in patient with a liver disease. A. Lidocaine. B. Bupivacaine. C. Procaine. D. Atidokine. Answer is C. 019. Which of the following local anesthetics is preferable in patient with pseudocholinesterase deficiency? A. Procaine. B. Ropivacaine. C. Tetracaine. D. Benzocaine. Answer is B. 020. The primary mechanism of action of local anesthetics is A. Activation of ligand-gated potassium channels. B. Blockade of voltage-gated sodium channels. C. Stimulation of voltage-gated N-type calcium channels. D. Blockade the GABA-gated chloride channels. Answer is B. 021. Which of the following local anesthetics is more water-soluble? A. Tetracaine. B. Atidokine. C. Procaine. D. Bupivacaine. Answer is C. 022. Indicate the local anesthetic, which is more lipid-soluble. A. Bupivacaine. B. Lidocaine. C. Mepivacaine. D. Procaine. Answer is A. 023. The more lipophilic drugs, A. Are more potent. B. Have longer duration of action. C. Bind more extensively to proteins. D. All of the above. Answer is D. 024. Which of the following fibers is the first to be blocked? A. Type A alpha fibers. B. B and C fibers. C. Type A beta fibers. D. Type A gamma fibers. Answer is B. 025. Indicate the function, which the last to be blocked, A. Pain, temperature. B. Muscle spindles. C. Motor function. D. Touch, pressure. Answer is C. 026. Which of the following fibers participates in high-frequency pain transmission? A. Type A delta and C fibers. B. Type A alpha fibers. C. Type B fibers. D. Type A beta fibers. Answer is A. 027. Which of the following local anesthetics is an useful antiarrhythmic agent? A. Cocaine. B. Lidocaine. C. Bupivacaine. D. Ropivacaine. Answer is B. 028. Indicate the route of local anesthetic administration, which is associated with installation within epidural or subarachnoid spaces. A. Topical anesthesia. B. Infiltrative anesthesia. C. Regional anesthesia. D. Spinal anesthesia. Answer is D. 029. The choice of a local anesthetic for specific procedures is usually based on A. The duration of action. B. Water solubility. C. Capability of rapid penetration through the skin or mucosa with limited tendency to diffuse away from the site of application. D. All of the above. Answer is D. 030. Which of the following local anesthetics is a short-acting drug? A. Procaine. B. Tetracaine. C. Bupivacaine. D. Ropivacaine. Answer is A. 031. Indicate the local anesthetic, which is a long-acting agent. A. Lidocaine. B. Bupivacaine. C. Procaine. D. Mepivacaine. Answer is B. 032. The anesthetic effect of the agents of short and intermediate duration of action cannot be prolonged by adding A. Epinephrine. B. Norepinephrine. C. Dopamine. D. Phenylephrine. Answer is C. 033. A vasoconstrictor does not A. Retard the removal of drug from the injection site. B. Hence the chance of toxicity. C. Decrease the blood level. D. Reduce a local anesthetic uptake by the nerve. Answer is D. 034. Vasoconstrictors are less effective in prolonging anesthetic properties of A. Procaine. B. Bupivacaine. C. Lidocaine. D. Mepivacaine. Answer is B. 035. Which of the following local anesthetics is only used for surface or topical anesthesia? A. Cocaine. B. Tetracaine. C. Procaine. D. Bupivacaine. Answer is A. 036. Indicate the local anesthetic, which is mainly used for regional nerve block anesthesia. A. Dibucaine. B. Bupivacaine. C. Tetracaine. D. Cocaine. Answer is B. 037. Which of the following local anesthetics is used for infiltrative and regional anesthesia? A. Procaine. B. Lidocaine. C. Mepivacaine. D. All of the above. Answer is D. 038. Indicate the local anesthetic, which is used for spinal anesthesia. A. Tetracaine. B. Cocaine. C. Dibucaine. D. Bupivacaine. Answer is A. 039. Which of the following local anesthetics is called a universal anesthetic? A. Procaine. B. Ropivacaine. C. Lidocaine. D. Bupivacaine. Answer is C. 040. Most serious toxic reaction to local anesthetics is A. Seizures. B. Cardiovascular collapse. C. Respiratory failure. D. All of the above. Answer is D. 041. Correct statements concerning cocaine include all of the following except A. Cocaine is often used for nose and throat procedures. B. Limited use because of abuse potential. C. Myocardial depression and peripheral vasodilation. D. Causes sympathetically mediated tachycardia and vasoconstriction. Answer is C. 042. Which of the following local anesthetics is more cardiotoxic? A. Procaine. B. Bupivacaine. C. Lidocaine. D. Mepivacaine. Answer is B. 043. Most local anesthetics can cause A. Depression of abnormal cardiac pacemaker activity, excitability, conduction. B. Depression of the strength of cardiac contraction. C. Cardiovascular collapse. D. All of the above. Answer is D. 044. Which one of the following local anesthetics causes methemoglobinemia? A. Prilocaine. B. Procaine. C. Lidocaine. D. Ropivacaine. Answer is A. 045. Procaine has all of the following properties except A. It has ester linkage. B. Its metabolic product can inhibit the action of sulfonamides. C. It readily penetrates the skin and mucosa. D. It is relatively short-acting. Answer is C. 046. Correct statements concerning lidocaine include all of the following except A. It is an universal anesthetic. B. It has esteratic linkage. C. It widely used as an antiarrhythmic agent. D. It is metabolized in liver. Answer is B. 047. Which of the following local anesthetics is more likely to cause allergic reactions? A. Lidocaine. B. Bupivacaine. C. Procaine. D. Ropivacaine. Answer is C. 048. Tetracaine has all of the following properties except A. Slow onset. B. Low potency. C. Long duration. D. High toxicity. Answer is B. 049. What is the main mechanism of action of local anesthetics? A. Inhibition of acetylcholine release. B. Blockade of voltage-gated sodium channels. C. Stimulation of GABA receptors. D. Blockade of calcium channels. Answer is B. 050. Which of the following local anesthetics is a naturally occurring alkaloid? A. Cocaine. B. Lidocaine. C. Bupivacaine. D. Procaine. Answer is A. 051. Which local anesthetic is often used in dental procedures for its quick onset and moderate duration? A. Lidocaine. B. Bupivacaine. C. Procaine. D. Tetracaine. Answer is A. 052. Which local anesthetic is most likely to cause cardiotoxicity at high doses? A. Lidocaine. B. Bupivacaine. C. Prilocaine. D. Procaine. Answer is B. 053. Which of the following is not a characteristic of local anesthetics? A. They cause reversible nerve conduction block. B. They cause loss of sensation without loss of consciousness. C. They primarily act on the central nervous system. D. They can cause systemic toxicity if absorbed in large amounts. Answer is C. 054. Which local anesthetic is known for its surface anesthesia and vasoconstrictive properties? A. Cocaine. B. Lidocaine. C. Bupivacaine. D. Procaine. Answer is A. 055. Local anesthetics are less effective in which type of tissue? A. Inflamed tissue. B. Healthy tissue. C. Muscular tissue. D. Adipose tissue. Answer is A. 056. Which local anesthetic has a unique property of causing vasoconstriction rather than vasodilation? A. Procaine. B. Lidocaine. C. Cocaine. D. Bupivacaine. Answer is C. 057. Which of the following local anesthetics is most suitable for use in epidural anesthesia during labor? A. Lidocaine. B. Bupivacaine. C. Prilocaine. D. Tetracaine. Answer is B. Thank you for watching this video on Pharmacology MCQs. If you found this content helpful, please give it a thumbs up and share it with others preparing for government exams like Railway Pharmacist, ESIC, SSC Pharmacist, SBI Pharmacist, and Junior Pharmacist. Don't forget to subscribe to Mr. X the Pharmacist for more MCQs.